Hello, my name is Dr. Justin Mackey, and I am the Program Director of the Radiology Residency Program at Mercy Catholic Medical Center. Thank you for taking the time to watch this video and learn a little bit about our residency program. We are primarily based at Mercy Fitzgerald Hospital, which is a community hospital in Darby, Pennsylvania, located approximately 5 miles outside of Philadelphia. Our department consists of 10 residents and 11 faculty, all of whom are fellowship trained. I believe the strength of our program is the strong relationship between resident and faculty, as we have no fellows and all cases are interpreted one-on-one with the attending radiologist. Our residents have ample opportunity to pursue research, and a complete list of scholarly activity is available on our website. Our residents are also able to pursue competitive fellowships in programs across the country in all subspecialties. We hope through this video to convey what makes Mercy a special and unique place to complete your radiology training. Thank you again for watching. There are many strengths of our program. I think one, I would mention the faculty and the residents. Everybody's very motivated. There's a good learning environment here. We take the best from both worlds, if you take an academic institution and a community program. So a community program like ours will have a lot of volume. We don't have fellows to take away our cases. And you get some independent work you can do. So you learn to stand on your own feet before you go into the real world.
We are in charge of every single case, as simple or as complex as it might look, as well as with procedure. And I think this is very important, especially for people that would like to do procedures when they are attendings, when they become attendings.
There's a lot of variety in the cases that we see because we serve the underserved population, so we see a lot of variety of pathology that we normally won't see in a setting like ours.
What we have been able to achieve with resident education is something rather unique. Our structure allows the program and the department to be much more flexible. We're not tied to rigid pre-existing structure of a large academic center, and we're able to deploy the resources to optimize the training.
Definitely the education that the residents can get here is exceptional.
In the recent survey of physicians performed looking at all of the services and comparing to national benchmarks, actually radiology was by far the most respected and liked department in the hospital.
I think there's no better compliment you can give a program than how we view our own trainees. Although we're a small place, we've hired over the years many of our trainees back to work with us. They go off to great fellowships, they succeed at those fellowships, they are able to obtain many different job offers, yet they choose to come back here because of the environment and the close-knit nature of us.
I've worked here since 2011, first as a resident, and then I went on to do my fellowship at Penn, and then decided to come back here as faculty, so it's been a good experience.
From the first time I entered the Mercy as a first-year resident, I feel that I entered into a big family with full respect and full support from the hospital administration, staff, and faculty. When I was offered to come back to Mercy, I didn't hesitate to come back.
We have a perfect relationship with the faculty. We're more like a team, like a family. They're very supportive. Whenever we have any question, we can approach any of the faculty.
All our attendees are, eager to help, to train, to teach.
They will edit every line of the report you make, so you get feedback on everything you say and you do, so it makes you grow really fast.
It is a joy for me to come to work every day, and it's a joy for me to work with residents. It's an amazing pleasure to see them grow during the 4 years of residency.
Even when the unforeseen happens, like during the COVID era, we were greatly supported by everybody in the department.
There is a great relationship between the attendings and the residents. And the most important thing, which I would say, it's a resident-driven program.
I've never been at a place where resident concerns were so much listened to and respected.
They're always looking for feedback, and every time we do some changes to the curriculum or to the way the lectures are being given, they always look for feedback from every one of the residents to see if things are going well.
Every year we try to do something better. Not because something's bad, we simply try to make something better. And when you do this every single year and you do it in a rational fashion with a feedback, where if it wasn't successful, let's try again.
I really appreciate that this program always is progressing in terms of providing the world-class technology.
A lot of community programs, they don't have top-notch equipment, but we have state-of-the-art equipment here. One of them being our 3G magnet. We have contrast-enhanced ultrasound, and then we have probably my favorite, which is our dual source and dual energy CT scanner. You can scan the entire heart in a single heartbeat.
We recently bought a 3 Tesla MRI. We have dual energy CT where most of the studies are done there.
It just improves the whole clinical experience, especially for the patients. They just get in and get out quicker than ever before.
We're really at the top of the game of all of the current technologies. MRI elastography, quantitative imaging, breast MR, prostate MR, all of the fancy MRs that are currently available. We have established a very successful MSK program with MSK ultrasound. To improve that, we just purchased a brand new Canon ultrasound unit, which is specifically designed for MSK ultrasound because it's able to image superficial structures.
In my world, as the head of breast imaging, we have the ability to do contrast-enhanced mammography as we're figuring that stuff out. We certainly have tomosynthesis, full-scale breast imaging equipment with ultrasound, MRI, full-time biopsy capability, multimodality biopsy capability. And we are a breast imaging center of excellence, which is pretty unique in the community setting.
All this gives us the opportunity to have higher resolution, better training, and more in-depth concept and learning the detailed anatomy for us and for our residents.
Talking about the technology, radiology, it's all about technology, right? Everything that is there in 2020 to offer, we have that.
Also, vendors like to work with us because of our academic strength and publications. They know if they get their top technology to us, it's going to make its way into the literature pretty quickly, so that's attractive.
It is extremely exceptional, I think, in this program that all the residents are involved in very good high-level research projects.
Everyone has opportunity to present at national conferences and do anything from a case report to IRB-approved project. And of course, we have great mentors here who will advise us.
We have protected research time for the residents, and we have Symposium, which is like a training experience for the residents to present their projects.
Our residents, by creating presentations, writing papers, become experts in a given area. More importantly, they learn how to become experts so they can replicate and continue to do this.
We are very productive. A lot of our residents publish multiple papers before they pass out, and that helps them get into better fellowships.
I was able to go to UCSC, one of the top-notch MSK fellowship programs in the country. It didn't take long after my fellowship I realized that I was really well prepared.
When I went to Penn, initially I had thought that it would be a difficult transition, that being a much larger hospital, but I had no trouble at all. So all in all, it was a great experience.
Our track record for fellowship placement is really good here. I just met my top priority for fellowship, and some of my colleagues just did the same.
I was amazed and surprised at how much the attendings were basically supportive and concerned and caring about my future fellowship and also job.
You are at the forefront of everything, like all the diagnostics in the IR, you are at the forefront. So you can take as much case load as you want.
Practically every single exam, we do a personal readout with the attending.
When I was a resident, the first time I saw an EMR was during my 4th year, and it was felt to be too difficult for a first year to read. We do the diametrically opposite. First year residents, they rotate on all of the services. We expect them to be able to read cardiac CT, cardiac MR, MSK MR, complex abdominal MRIs.
Here at Mercy, we have a unique experience of musculoskeletal ultrasound, and we end up doing a lot of procedures under supervision and then independently as residents, including those which are aspiration of the joint, ultrasound guided or fluoroscopy guided, as well as steroid injections. And recently we started doing something more sophisticated, such as barbotage for calcific tendinitis.
You start getting more and more responsibility along the time goes by. We start getting evening calls where we are only with one attending from offsite, but we have 3 hours where we're the only resident in the hospital. Then we will have weekend calls. In the weekend calls, we will be the only resident taking care of all the studies, with an attending. So we still have supervision, but it's more, you become more independent.
On night floats, there's a resident that covers the whole hospital services. We are privileged to be exposed to this feeling of being in charge. Initially, it may seem overwhelming, but by the time we actually start, we discover that it's actually like the best experience.
I can say that there's a lot of emphasis on resident happiness, wellness.
I really think our unique atmosphere allows for our residents to see the best version of themselves. We see them not only as individuals, but as people with families and backstories and life experiences.
The Philadelphia area is a really good place to live and work because you have a lot of options for housing, affordable options, and there's not a lot of traffic.
We're close to the beach, close to New York, close to DC. There are plenty of things to do in Philadelphia.
I think this is just a great place to do residency. We have like state-of-the-art equipment, we have an academic focus, we have residents going to conferences, publishing papers, matching in great fellowships, and you get that all in an environment that's friendly.
You know your colleagues really well. You get to know your referring clinicians, your colleagues in your own department. We all work together as a team.
With our close-knit nature, our family-like atmosphere, our state-of-the-art technology, it really gives the resident every opportunity to succeed, and we can cater the experience to each individual resident's needs.
If you come to Mercy, you will work very, very hard, but that work will be driven towards making you best radiologist possible. And this is why our residents are highly sought after, and this is why they get fellowships that they get. Many of them are willing to come back to us as faculty. Speaks volume about the environment, quality of education, and the quality of our daily work.
This is a great program. We have very dedicated, very brilliant attendings that are always focused to teach us.
If you are looking for a perfect combination of academic and community-based training, come to Mercy.
Truth be told, if I'm to do this over again, I will still gladly choose Mercy.